Hey, this is Dr. Mark Ellis from the Georgia Chiropractic Neurology Center. We are amazed here, even after years of doing this, how frequently patients come in and they think that there's something wrong with them, that they're crazy, that things aren't going well, because of how their concussions are affecting and impacting their lives and their families' lives. Traditionally, patients were told that after head injuries that they were supposed to rest and that they were supposed to stay quiet until they got better. And many people get better after 2 weeks and their symptoms will improve. And then a lot of people do not get better, and they'll seek care from medical physicians, and the physicians frequently will follow the standard protocols and they'll put them on rest for even longer periods of time or more intensive rest, taking them out of school, taking them out of work, having them rest in dark rooms, avoiding light like from televisions or computer games. And the people end up getting worse, actually, very, very frequently. Their symptoms don't just spontaneously resolve. And what we found in 2006, it was published in the Journal of Psychosomatic Medicine, that prolonged rest can lead to physical deconditioning, metabolic disturbances, fatigue, and reactive depression for people. So as they begin to rest over prolonged periods of time, they get fatigued, they get depressed, they get metabolic disorders, gut symptoms can change, headaches, all these things can stay in place, and they'll go again to a doctor. And very frequently, the doctor at that point will prescribe them antidepressants. So what we want to understand is that the primary forms of treatment, according to the Journal of Neuro-Rehabilitation, are rest, education, coping techniques, support and reassurance, antidepressants, and then neuro and cognitive rehabilitation. And so when you look at all of these techniques, they are very much about helping the person to just cope with the situation, and after the coping doesn't work, they're either prescribed a neuro-rehabilitation program or they're prescribed antidepressants. Most often, both oftentimes frequently happen. So the neuro-rehabilitative programs can fatigue the patients. So they're either going to help them and the person's going to get better and their brain is going to heal, or they're going to fatigue them. If the neuro-rehabilitative programs don't work, at this point the person begins to think that this is the new norm for this life, that they're just gonna be like this all the time. And oftentimes they go years being told that they're just crazy, that they're depressed, that they need to just suck it up and get better. And these are really horrible approaches for the people who are in this position, especially when there's research out there, like the research from the Journal of Head Trauma and Rehabilitation in 2013 from Silverberg and Iverson. And what they found was that inactivity prolongs recovery from disorders like vestibular disorders or depression or post-traumatic disorders. So what ends up happening is these people are getting worse. We know that as they get worse, they're not going to feel good, they're going to be depressed, but they're being told that they should just get over it. So what we do here at Georgia Chiropractic Neurology Center is we bridge a very important gap, which is that in medicine, the people who know the brain the best are neurosurgeons and medical neurologists, but neither of them will ever do the physical medicine necessary to truly rehabilitate the patient. So again, the things that are classic for the treatment are rest, education, coping techniques, support and reassurance, and antidepressants. All of those are education and medication, and the only one that is an actual rehab technique is the neuro-rehab. The neuro-rehab's most frequently performed not by the medical neurologist, but by a physical therapist or an occupational therapist or somebody like that, who most of the time is not trained at very advanced levels in how the nervous system works. So we bridge a very important gap in that we are trained in how the nervous system works, and we're the ones who are actually doing the therapy. So we are able to create a tailor planned approach for the individual. And as we do the treatments, we're able to watch, did that treatment push them too far? Can they tolerate a little bit more? And we're modifying and adapting the care right there as we're watching the patient, as opposed to just following a prescribed protocol-based approach. And what this has allowed us to do is this has allowed us to see usually the most difficult cases, the ones that have already been to 20 or 30 people, oftentimes who've had it for years, and get them better, as well as take people with recent head injuries and make sure that they get better very quickly and get back to their life, so that they don't ever get to that place where their new norm is to not feel good.